There's been a great amount of research and interest in Tommy John surgery over the past several years. As an overall successful surgery with regards to return to play, even in elite level athletes, there's been more recent emphasis on statistical performance after return to play, specifically looking at ERA, whip, workload, and pitching velocity. Very little, however, has been evaluated on how performance may be affected by specific tear patterns of the ulnar collateral ligament, including proximal or distal tears, acute as in one pitch or chronic tears, partial or complete tears, as well as the specific procedure performed, being the modified Jobe or docking technique, as well as graft types such as palmaris or gracilis. So we look to evaluate our Major League Baseball pitchers and evaluate their performance 3 years prior to surgery and then 3 years after reconstruction, and specifically evaluate certain tear characteristics, the exact surgery performed, and the graft type used, and how this may affect their overall performance after reconstruction, as well as any performance measures that may lead to certain tear patterns over others. Overall, we included 46 pitchers that played only at the Major League Baseball level. Our pitchers showed an overall 96% of return to play rate, with 82% returning to the Major League Baseball level. We found several differences with regards to tear patterns, surgery, and graft type. The type of surgery performed, whether the modified Jobe or docking, did not seem to have an effect on overall return to play or performance after surgery. The choice of graft, however, did appear to have a significant difference, with palmaris grafts returning at a much higher rate and playing longer after surgery. However, this was comparing only a small number of gracilis grafts overall. When looking at features specific to the tear itself, pitchers that pitched at a higher velocity were much more commonly having distal tears, and in the distal tear group, pitching about 2.5 miles per hour faster. And they also had a better performance prior to surgery. Proximal tears, however, improved their performance to the distal tear level after reconstruction, showing good improvement with surgery. Pitchers with complete tears compared to partial tears played about 2 years longer after surgery. Complete tears also had significantly better ERA prior to surgery, showing that partial tears may have an effect on performance leading up to surgery or injury. Finally, looking at the acuity of tears, performance was similar between acute and chronic tears. Chronic tears, however, showed a significant benefit from surgery, with a large improvement in ERA after reconstruction, improving from 4.49 to 3.81 after reconstruction. In conclusion, the study shows that there are significant differences in performance that can be seen at the Major League Baseball level with regards to certain tear characteristics and to some extent the reconstructive procedure. In the end, the best case scenario for an ulnar collateral ligament injury would be to have a chronic, complete proximal tear that's treated with a palmaris graft. Noting there are significant performance differences that can be seen leading up to an ulnar collateral ligament tear as well as after reconstruction, it would be important to evaluate these findings in a broader population at multiple talent levels rather than just the Major League Baseball level, and finally correlating these findings to help maximize prevention and performance after reconstruction. Although indications for surgery and technique are important, tear characteristics can have a significant effect on pitching performance leading up to injury as well as after reconstruction.